I'm Steve Odland from CED. For those of you who have not met, I'm very pleased to see everybody here today in this special evening to recognize and honor David Cordani, the CEO of Cigna. I want to first thank our partners whose names you see on the screens. Without them, this wouldn't be possible. Amazon Web Services, America's Health Insurance Plans, Cigna, of course, Carl Mooring, DaVita, Delaware North, Deloitte, DFC Global, Edelman, Genworth, Interpublic Group, Korn Ferry, the Mays Business School at Texas A&M. I have no idea why the Aggies are here, David, do you? McKesson, the National Math and Science Initiative, Suntory, TIAA, and the Virginia Tourism Corporation, and there must be something in there too, but thank you to all of you. I think, as everybody knows, business statesmanship is at the forefront of CED's work and our purpose and the hallmark of the dinner tonight. Business statesmen and women take an expansive view of their responsibilities. In the business world, it's not only about running our companies well, taking care of our customers, taking care of our employees, taking care of our owners, but it's also about engaging in the public square as business leaders with our elected officials to advocate for sound and fair public policy. And with that, the nation becomes stronger. And this group was founded in 1942 by a group of business people who were true patriots and who helped to craft the Marshall Plan in Europe, the Bretton Woods Agreement, which created the IMF, and the World Bank. And so next year is our 75th anniversary, and we are recognizing our anniversary with the publication of a new book called Sustaining Capitalism, Bipartisan Solutions to Reform. But all of that you know, and we appreciate all your support. But tonight is about David Cordani. Here to introduce David and speak more about why David is so deserving of this award is Kent Thiry. Kent is the chairman and CEO of DaVita and the CEO of DaVita Medical Group. DaVita is the leading kidney care company in America, and if you have too much wine tonight and you're feeling a little funny, we've got the folks here to take care of that. DaVita manages and operates healthcare organizations and physicians networks across the United States. Under Kent's leadership, DaVita has been named to the Fortune magazine's most admired company for over a decade, a tremendous accomplishment. Prior to joining DaVita, Kent served in leadership positions, including chairman and CEO of Vivra Specialty Partners, and he was a partner at Bain & Company. Outside of DaVita, he also is a member of the Harvard Business School's Board of Advisors. Kent, welcome. Thank you for being here. Come to the stage, please.
It's an honor to be here with this group in this city and in this beautiful room. A Buddhist monk, Thich Nhat Hanh, said, "Speak with your life, not just your words." I've gotten to know David quite well over the last decade or so, and this is one free market CEO who does speak with his life, not just his words. He's a very successful CEO from a free market, capitalistic, stock market point of view. But that's appropriately not why he's being recognized here tonight. And the manifestations of the way in which he lives, sort of the breadth and depth of his life, not just the length, are many and come in different domains. First, some domains that are close to his day job, which is to say healthcare. He is literally a global and prominent voice for healthcare reform. Since I'm in healthcare, I can say these words with some authority, and he's particularly known, and Cigna is particularly known for an intense orientation around empowering individuals to take more control over their health and giving them the tools to be able to do so. In addition, he's one of the most thoughtful commentators on the architecture of the American healthcare system and how that needs to change in order to create something that's sustainable and higher performance for our people. And going from sort of the sublime to the much more secular, he's also a leader in the fight against the current amazing opioid acute crisis. And Cigna may be the only major payer in America which has set a specific, quantified, and substantial goal for reducing the number of our people and often our children who succumb to that very tragic problem. Then moving more broadly, or kind of adjacent to healthcare generally, on top of those elements, on top of those facts, he's a charter member of the Children Obesity 180 campaign and program, which has done, for those of you who don't know, masterful things by going into communities on a holistic basis, addressing everything from mental health and social pressures and availability of health care and education, both for the kids and the parents and the caregivers, in order to make truly transformative changes in the rate of childhood obesity in the real world, in real communities, on a scale basis. Very few people can say those words out loud. He can, but rarely does. On top of all that, he's a very substantial supporter of the March of Dimes. On top of all that, he and his wife, Sherry, have just committed to fund a travel group that's going to cross through much of America and spend multiple days a week providing free biometric screening and health coaching to both students and low-income folks across the country. On top of that, endowed a scholarship for veterans at his Texas A&M roots. On top of that, he's part of the Achilles International, I'm not going to get the name of the group right, the Achilles International team for veterans, and multiple times per year, he's out there running a 5K, a 10K, a half marathon, or a marathon with disabled veterans, whether it's in a wheelchair or using there's new fancy prosthetics. He's there leading veterans to do things that they never thought they would ever do again in their lives. And so, just think about it, that list of things that he does on top of being a successful CEO. I know a lot of CEOs. I know very few where there's a list like that, from strategic to organizational and then to highly personal, being out there running with one human being and making that incredible imprint. And this is what this man does. On top of all that, I've known him long enough to know this is a reliable, present, engaged daddy for his two neat kids. So I am not intimately familiar with your group. I am intimately familiar with this man, and he deserves the award that you're honoring him with, David Cordani.
Thank you, KT. That was quite touching and nice. I appreciate it very much. I guess it'll be another decade before I ever hear you say anything nice about me again, but since we've known each other quite well. Steve, thank you for the opportunity. To the CED organization, thank you for the wonderful acknowledgement. On behalf of Cigna Corporation, we're about 42,000 large around the world who wake up every day trying to change people's lives. And we're proud to have over 90 million customer relationships around the world, having grown from about 60 million customer relationships around the world that we serviced about 7 years ago. And we're on a direction toward, as a health service company and a global health service company, to try to improve the health, well-being, and sense of security of the people we serve. I'll be brief tonight. In short, our drive comes from a view that we need to move from an environment of sick care intervention to an environment of truly engaging in healthcare, which means we need to understand and connect the whole person. We need to understand the whole variety of forces that come to work that affect a person's sense of health, sense of well-being, peace of mind, and understand where people are in their life journey and their health journey, and have the programs and the resources to meet them along that journey. As we all know, it tends to take a windy and unpredictable road. Our belief is rather pragmatic and simple. Kent made reference to, first and foremost, how do we seek to truly understand an individual and then engage, support, and provide the guidance and services to an individual as they go through that health journey, and provide the incentive structure around that from a support standpoint. And then here in the U.S., trying to greet that with the evolution to what is called value-based care. But to oversimplify, it's moving from paying for volume of services to the value of services, where you try to do the same thing. You engage healthcare professionals, physicians, hospitals, pharmaceutical manufacturers, service providers, and try to align incentives, provide actionable information, and support resources like nurses, health coaches, behavioralists, nutritionalists, social workers, home health workers, et cetera, to try to optimize the value of care for an individual. And the good news is, on the bright spots, when those two forces come together, good things happen. Good things happen to optimize the health for the healthy, keep them healthy. Very importantly, identify the healthy at-risk population, and about 25% of Americans are healthy at risk. About 25% of the people in this room are healthy at risk. That if those risks go unidentified, there will be a major health event about 2 years out, either in a chronic or an acute sense, and how do we avoid those together, and then optimize the quality of life for those who are confronting chronic or an acute health outcome. As Kent noted, as an organization, we also believe in making a difference, as we discuss, in the communities we work, serve, and play in each and every day. So around the world, we seek to make a difference, whether that's clean water in India, education in China, housing in Indonesia, et cetera, supporting our team through our foundation, but also through walking the talk and then allowing people to have time off from work to dedicate to their communities. And I'll just call out a final two. I was pleased that Kent referenced the opioid epidemic, because here in our country, we are systematically poisoning our population in a way. And we stepped back and looked at the data and said we need to do something about it. First, elevate the awareness. Second, change the conversation, expand it, and let's move upstream and reduce the consumption of opioid pharmaceuticals, where we consume 80% of the opioid pharmaceuticals in the world for about 5% of the population, and get more active in that. And then provide the medical assisted therapies that are required for those that are addicted. We know that recently 2/3 of the individuals that became addicted to heroin started with pharmaceuticals. We need to stop that process. And then, of course, supply the more heavy support that's necessary down the line. So expanding that. And as Kent noted, we stepped up and we've partnered with NPR, we've partnered with the Surgeon General, but we also stepped forward and said we will reduce the consumption of opioid pharmaceuticals for our population by 25% for all the lives we serve over the next 3 years, which will take it back to pre-epidemic levels. Seeking to make a difference in the community, that's what we do each and every day. So on behalf of my colleagues, it's an honor to accept this award. This will motivate us to do even more as we look forward. And rest assured, you'll never hear Kent Thiry say that many good things about me over the next decade ahead. But Kent, again, thank you.